Hi, this is day 8, and I have been doing research to answer some of your questions. And everybody wants to know what's the difference between a detox reaction and a healing reaction. And I wish it's funny because I've heard it talked about a lot. I've heard it talked about on the Gerson Therapy Support Facebook page. It's talked about, but I'm not finding in the book an explanation of perhaps a difference of those two terms. There is an explanation for the healing reaction, okay? And it's a good thing. It means the body finally has enough strength to cause an inflammatory reaction in an area of the body that needs healing. And sometimes it's accompanied by a fever, which they do not recommend trying to lower the fever. They said that's the body's way of bringing that healing in there. You know, cancer cells die when you have a fever, so that's a good thing, and it's bringing a healing inflammation to an area. A person could experience a number of discomforts during that time. They could have headaches, they could have tiredness, they can have depression, they can get angry. Lots of times emotional stuff will come out when a person has a healing reaction. Trying to think what else. I read a lot, and now, of course, it's trying to pull it all back for you. I'm going to grab my book. I'm going to show you. I was looking in this book by Max Gerson. It's a cancer therapy, results of 50 cases. And I was also looking in this book. This is the Healing the Gerson Way book. And both are very informative and very educating. And I had a hard time focusing because I just wanted to read. I'd get off on a rabbit trail and be like, oh, this is interesting. And then I'd start looking up other areas where it was written about. And so I've got more stuff to talk about on another day. The healing reactions, there was more clarity on reading it out of the Healing the Gerson Way book. So that's this one. So it says understanding healing reactions. They're also called flare-ups, okay? Essential part of the Gerson therapy. It is important that patients understand their nature and function before embarking on the full treatment, since healing reactions are somewhat paradoxical in experience. Although they can produce a number of unpleasant symptoms, they should be welcomed as evidence that the therapy has kicked in and is working well. So there you go. It says, let's see how this goes. And this is kind of typical of people. It says, the necessary process is likely to begin, as a rule, after the first few days on the full Gerson program. The patients feel better, they suffer less pain, they have improved appetite, and lost my place when I looked at you, and see reductions in their external or palpable tumors. Naturally, they are greatly encouraged by these positive developments. That is the moment to remind patients that a healing reaction may be on the way and to explain how it is going to promote detoxification. Without proper preparation, the sudden shift from well-being to its opposite would be hard to bear. When the body is first turned around from advancing cancer or other chronic disease towards healing, Dr. Gerson called the healing mechanism, and this healing reaction, he calls it a mechanism. He sees it as a function of the body that's important. And this is what makes the difference between this and other therapies. When I read this about the healing mechanism and realized something different was taking place in the body, it wasn't just a diet, I knew something was different about the Gerson therapy. So anyhow, this healing mechanism is being activated and the immune system begins to kick in. The body produces a healing inflammation and releases toxins from the tissues, producing a massive toxic load that has to be eliminated from the liver. The process is sometimes accompanied by a healing fever and even spells of depression and panic. So a person could be like panicking and frightened too if they don't understand. And also it has to do with just the toxins in the brain, because it's coming out so fast. So what you do is, you give them extra coffee breaks. And sometimes if their tummy's too upset, you can do an implant with the juices, and the green juice, and they hold it rectally just so they could absorb it. And there's other things. The goal here is not to tell you how to take care of a healing mechanism. It's just to let you know that there is such a thing, and that they're good, and that they're important, and that you can manage them. Okay, they can last anywhere from a couple hours to a couple days, depending, but it's not unusual for there to be a series of at least three healing reactions. One in the very, very beginning, one within the first few weeks, and then a few months down the road. And yet there's been people who have healed on this therapy and never had a healing reaction. So, there's no guarantee. It doesn't mean you're not healing if you don't have one. So it'd be nice if you didn't have to go through that. But the interesting thing is, I think I'm starting to have a healing reaction myself. I've got chills today. I've had bladder irritation. We were just talking about a UTI yesterday, and that's what it feels like. It's like, ugh, but I'm going to tough it out, because I don't want to go on a medication if this is something that my body wants to heal. So I'm going to hang in there. And of course, it's Friday. So let's see how the weekend goes. And then, we'll make a decision on Monday. If this is a healing reaction, I would think it'd be better by Monday. And if it's not, I'll be giving the doctor a call. So the other thing I realized, here we were talking, like I said, talking UTIs. I had forgotten about how the Hippocrates soup heals the whole urinary tract. It's not just the kidneys. It also helps with the bladder, also helps with the urethra and ureter, the different connectors, and it can help with that whole area. And so I ran out of soup. I didn't have any yesterday. And this morning I woke up, it's like, oh yeah, I need to make my soup. And then within a couple hours I could feel, irritation starting. And it's like, oh, I think I should have been doing my soup. And when I was doing the whole protocol, hot and heavy, the first 2 years, I needed a quart of soup a day. I know most people, they say to have 2 cups a day. I really needed 4 cups. I had a lot of kidney pain, and that helped me to not have kidney pain. So I know it was healing, but maybe I need to go back to that for now. Maybe I need to go back to my quart of soup a day, and just keep things moving through. Keep those kidneys flushed, keep the bladder flushed, and not just with the juices. So anyhow, a detox reaction, my understanding, I haven't been able to find it in print. My understanding of a detox reaction, different than the healing reaction, is just when you've got some more toxins coming out and you might be headachy or tired or just kind of a malaise. It's not a big deal. A healing mechanism, a healing reaction is a big deal. A detox reaction is not as big a deal. It just kind of passes and it goes. You do an extra coffee break or something and you're okay. It just, your body's working on it, but it wasn't necessarily a healing reaction where it's trying to heal. And they were talking about, it's very interesting to see all the things he talks about healing in there, healing long-standing high blood pressure, healing diabetes, healing arthritis, healing fibromyalgia, all these chronic conditions, and how the body can go in. The body doesn't say, oh, I'm going to heal this and not that. The body kind of looks at the whole body, and approaches healing holistically. And it can't just pick and choose what parts it wants to heal. In fact, it's interesting, people will get healing at old scars. Somebody had an appendix out years and years earlier, and then one night they woke up with pain in their side and redness and realized it was at the site of where the appendix had been removed, and it was just healing that scar tissue inside. I thought that was interesting. So, yeah, I had a lot of that. I had a lot of that healing pain in my lower abdomen because I had 2 C-sections and a surgery all in the same area, and that took time to heal. I don't have any more aching or pain in there anymore, but I had it on and off for that first year as things were getting healed inside. So that was interesting. So I don't know if that was as helpful to you as I wanted it to be. I wanted a real clear, okay, this is healing, this is detoxing. But all I can say is a healing reaction has a really good purpose. Of it's not just detoxing, it's also healing something inside, where a detox reaction is really just kind of kicking out more stuff. I mean, it's ultimately going to lead to your healing, but it may not be a healing mechanism at that moment. Does that make sense? Okay, that's it for today. Tomorrow, we're going to talk about liver juice. I've gotten on a rabbit trail with that, and it's been very interesting because somebody asked, what about having animal products? Didn't Dr. Gerson recommend fresh pressed liver juice? Yes, he did. And we're going to talk about that. So, and it's very interesting, especially in light of these days. Okay, so we'll see you tomorrow. Same time, same station. All right, have a good night. Bye-bye.